one thing that is true about mental health conditions and mental illness is they're really common. It's not something that we talk much about. Suicide is the second leading cause of death among those 10 to 34 years of age. It's the fourth leading cause of death from 34 up to the age of 55. About 20% of all kids will have a diagnosable mental health condition, and only 20% of those kids actually receive help care for their mental health condition. So the role of NCPAL, and kind of how I look at it, is the goal is to help kids receive treatment in their community. So our role is to help primary care identify those things, right? And to be a resource for primary care in identifying those mental health conditions and what can be treated. And I think that's really kind of where we intersect in helping take care of kids is in increasing access in a different way, which is really augmenting primary care, augmenting these integrated care services to kind of raise care in all these different settings to try and identify kids earlier, get kids started on treatment earlier. So we become kind of this resource for in primary care to help them feel comfortable with the treatment plan and help them manage that kid in primary care rather than referral to a specialist. What I would really love is for us to be able to be thoughtful about kids that are having challenges, and for us to be able to ask hard questions to try and identify kids that are struggling, and then for that access to be available. And that's really where this integrated care comes in, which is, right, we're not doubling the number of child psychiatrists anytime soon, right? So that access has to come from other places. And how do we support that access? How do we support those people that are going to provide that access? And that goes into a lot of advocacy and working with partners and really helping people feel comfortable about providing that care.